if you have any questions, if you can, oh, that's okay. If you can go ahead and just leave them to the end, that would be great. Or put them in the chat so that way sometimes I have a question and I always forget. So if you just want to put them in there, that way we can make sure we address them when we're done. Okay, well, I'm going to go ahead and share my screen. Is that okay now, Sam?
Go for it, all
Okay,
you.
okay. All right. Okay, let's see here. Please forgive me again. Okay, can everybody see my presentation? It should be the first slide.
Yes, looks great.
Okay, sounds great. So today, I am going to cover Medicare Preventative Services. I am Melissa Luna Ramirez, Southwest SHIP Coordinator. I am housed in Las Cruces, so I cover all of Southwest New Mexico. And towards the end of the presentation, I'm also going to show you the other SHIP coordinators throughout the state so that if you want some more presentations in your community, you know who to reach out to. So we've got a land acknowledgement as well, and this one I am going to read. The Aging and Long-Term Services Department, otherwise known as ALTSD, recognizes that Indigenous peoples, past and present, that have been stewards of this region since time immemorial. These lands are home to ancestral caretakers of numerous Pueblo tribes who would come to include Mescalero Apache, Jicarilla Apache, and the Dene Navajo Nation. Each of the tribes has preserved and retained their language, stories, traditions, and maintains profound cultural ties to the land. As we come together today, we recognize and honor the significant contributions of all Native Americans. ALTSD also acknowledges tribal sovereignty and tribal self-determination and is committed to building connections with tribal leaders, advocates, and stakeholders who share our mission to support lifelong independence and healthy aging among New Mexico's older adults and adults with disabilities. Today's workshop objectives. The Aging and Long-Term Services Department provides training and resources for New Mexicans to navigate Medicare. And this is just a little piece of all of the resources that we have. But today's workshop is going to include mental health, cardiovascular, and diabetes subject matter, and also what SHIP and SMP Medicare Support Services has for you throughout the state. Preventative services. So there's a lot of moving parts in Medicare, a lot of moving parts. So this is just one little drop in the bucket of some of Medicare's preventative services. Medicare preventative services programs, they're designed to find or prevent health problems early. When treatment is likely to work best, Medicare Part B, whether you get coverage from Original Medicare or Medicare Advantage Plan, or other Medicare health plans, all provide preventative services. The coverage for preventative services is based on criteria like age, gender, and medical history. So there's a lot of different moving parts with preventative services. A doctor may give a Medicare beneficiary a referral to go get some lab works done and so forth, but there's so many different things that our health goes through that our Medicare preventative services covers people differently depending on the coverage that they have. Paying for some of these preventative services. When using Medicare preventative services, most pay nothing for most of the preventative services. And that is if the provider accepts assignments. What that means is that the provider or the doctor or the clinic, wherever this individual is going for services, they have to have contracted to work with Medicare to accept Medicare. So when people are aging into Medicare, once they turn 65, or if they were disabled and younger than 65 and have Medicare disability, they need to check with their doctors to see if they are contracted to accept Medicare as the insurance coverage. There's a lot of preventative services that are covered, so there's really quite a bit that nothing is out of pocket for our individuals throughout the state of New Mexico. Some may pay more if the provider doesn't accept assignment, as I was indicating before. Some people will have to turn into self-pay because maybe that clinic or that doctor doesn't accept Medicare, so now they're going to have to pay out of pocket. There are some co-insurances or some deductibles that have to be met, and that's if they apply based on the insurance coverage that the insurance holder has. If if your health councils and you've got community people in your meetings and they're wanting to know about their Medicare, it's a huge change for everybody when they're going into Medicare. And also because they're no longer working. So now they don't have a human resources department or a benefits department. So they don't know who to go to ask for some help. And I should say a safe place because we're not agents. We don't sell or endorse. So if they call us, we're like, in a sense, their human resources department and their benefits department. So we can help them navigate what it is, what coverage they have and how it pays for preventative services. If the individual's doctor or the healthcare provider performs additional tests or services during the same visit that are not covered under preventative benefits, the individual will be charged. And if you notice, there's not any dollar signs here because it's a variable amount. Just depends on what the service is that's being done, if the clinic or the doctor or whoever they're seeing accepts the Medicare, and what type of Medicare coverage they have. So this is what you see on your screen right now is just a few of the items. Of course, we can fit on one screen that's covered under Medicare. But today we're gonna cover even more what you see highlighted in yellow. So that when I refer to cardiovascular today, cardiovascular disease, behavioral therapy, cardiovascular disease screenings, depression screenings, diabetes screenings, and Medicare diabetes prevention program. But the others that you see that are not highlighted, we're not going to cover those today. But if you think any of those are something that you would like a presentation for in your local health councils or another entity that you are networking with, and you see that this is something that they need, just contact us and we could present. Okay, depression in older adults. Among people older than 65 years of age, 1 in 6 suffers from depression and is estimated to occur in 25% of those with other illnesses. There is we do a lot of outreach. We are out in the state significantly, and depression is something we hear so many times, especially when you have these lifelong partners and then they lose their loved one, they've passed away, or they've been sent to a facility, a nursing home, or something of that sort, and now they're alone, or their adult children move away. Different things happen, and depression can occur. So there's suicide. Suicide among the older adults have the highest risk of suicide of all age groups, and is estimated that 50% to 75% of older adults who commit suicide saw their medical doctor during the prior month for general medical care, and 39% were seen during the week of prior to their death. So some symptoms of major depressions can include, as we can see here in our screen, people feeling sad or empty, less interest in daily activities, weight gain or loss when not dieting, less ability to think or concentrate, feelings of worthlessness, thoughts of death or suicide. A lot of the times in our local senior centers, there's a lot of chatter going on, and sometimes as where they're visiting, we hop on to different tables and try to visit with the seniors that are there and just kind of start a relationship with them so that we can catch something like this. That way, if we need to refer them out, we can refer them out. And making sure that they have Medicare so that so they can get the care that they need, and their Medicare can cover that. Medicare can cover that via depression screening. Medicare provides annual screening for depressions for applicants. So the annual screening must be done in a primary care setting with staff-assisted depression care supports, and to ensure accurate diagnosis, effective treatment, and follow-ups. So just recently, I was at a doctor's office, and there was a form I had to fill out, and it was just asking me those types of questions. They were screening me for depression. So that just seems like it's a typical thing. So it seems like and other people that I've spoken to that have gone to their regular doctor's visits, especially our seniors, sometimes they tell me, why are they asking me these questions? Why do they want to know how I feel? So it's really nice to know that there is just so much screenings going on in the doctor's office. There's also various screening tools that are available. The choice of tool at discretion of the clinician can be used, and the choice of screening that they use will be covered by Medicare. Diabetes. Diabetes is another screening, another preventive services that Medicare covers. It is a disease which your blood glucose or sugar levels are way too high. Your glucose comes from your foods that you eat. Insulin is a hormone that helps prevent the glucose get into your cells to give them energy. So there's two types of diabetes. We've got type 1 and type 2. The type 1 is when your body doesn't make any insulin. Type 2 diabetes, which is the most common that we see throughout the country or throughout the world, where our body doesn't make or use insulin well. The impacts of diabetes are significant for some, and some can control it by diet, exercise, and medication, and seeing their doctor regularly. The impacts of diabetes, though, the glucose stays in your blood. It can damage your eyes and cause blindness. It can damage your kidneys, and it can cause a heart disease or stroke. So the diabetes screening for preventive care under Medicare is pretty good that they have that to catch it so it doesn't get out of hand. Medicare Diabetes Preventive Services. It covers the following items: the screenings, as I've been mentioning before, the Medicare Diabetes Prevention Program, supplies and services, diabetes self-management training, and medical nutrition therapy services. So some of these are new for 2026. There was just the medication and the supplies that people were taking now, and the screenings, but now we've got the diabetes self-management training and the medical nutrition therapy services that are covered by Medicare, which is really nice because as our older adults are their food intake and their health is changing, the food that they take really does affect their health. So continuation here with the screening. Medicare may cover 2 screenings a year for people with any of these risk factors. As you mentioned before, that it covers, if they have these factors, they can have 2 screenings per year. If they have high blood pressure, a history of abnormal cholesterol and triglyceride levels, obesity, high blood sugar. Lab tests are also covered if 2 or more of the following items apply to our seniors. If they're 65 years or older, overweight, family history of diabetes, and a history of gestational diabetes, which during pregnancy or delivering a baby that was weighing more than 9 pounds. So these are some of the items that apply to individuals who can get additional diabetes screenings throughout the year. As we see on the bottom, we also note here that there is no cost if the provider or the doctor or the clinic accepts the assignment, meaning accepts Medicare. The Medicare Diabetes Prevention Program. In this case, Medicare provides this program for people who have pre-diabetes and want to prevent diabetes. So as some people age, checking on the time, as some people age, they get less active for different reasons, and but still they're consuming the same amount of food, so they're not really burning it up and burning the calories, so it's kind of sticking there, and then they're starting to gain some weight and be prone to being diabetic. So people who are pre-diabetic and want to prevent it, participants must do the following. They must provide a blood test from their doctor to identify that they have high blood sugar. They can enroll in the Medicare Diabetes Prevention Program with an organization that is a Medicare approved supplier. So there's a lot of programs that are new. We have a lot of people who are not utilizing some of these programs that Medicare does cover now. So if we could spread the word, that'd be great because we want to keep everybody as healthy as possible. The Center for Disease Control and Prevention, referred to as CDC, they must have an approved curriculum. They have an approved curriculum that is available and includes training on dietary change, increased physical activity, and weight loss strategies. Participants under this program must, to have it covered, they must be enrolled in Medicare. The Medicare that they need to have is they need to have Medicare Part B. There's a few parts of Medicare, so Part B must be something that they're actively enrolled in to have these screenings covered. They must have a BMI of at least 25, have no previous diagnosis of type 1 or type 2 diabetes other than the gestational diabetes. They must not have end-stage renal disease. They may not have any other services previously to this program, and they must meet one of the 3 blood test requirements within the 12 months of their first course session. The hemoglobin of their A1C test between the percentages that we see here, 5.7% and 6.4%, fasting plasma glucose, and a 2-hour plasma glucose. Medicare also covers up to 2 years of sessions, which include, as we see here on the screen. So this is a little bit more detailed of how this therapy works covered under Medicare. For the first 6 months for their core sessions, they'll have 16 sessions offered of at least a week apart, and they are available regardless of weight loss and attendance. So the previous screens before, there was an indication of what the BMI had to reach and so forth. But as they're progressing through this program and they're going to these sessions, if anything changes, they're still going to be able to complete it, and it's going to be covered by Medicare. During the months of 7 to 12, during these 6 monthly sessions, that is also still available regardless of their weight loss and attendance. Months 13 through 24, ongoing maintenance sessions. If you see the asterisk there, they just want to indicate here that there's no copay or referral. This is going to exceed after the year, but they still have to have Medicare Part B. They must achieve their weight loss. People who must achieve and maintain the weight loss and attendance goals to remain eligible during the new year. Everything must also be in person, but there's some virtual makeup sessions. The CDC must also approve the curriculum that's included in the training. The diabetes supplies and services. If any people who in your local areas, especially our rural areas, we hear some people say, well, I don't have access to good health care. There's nothing here, or I have to travel far. Diabetic supplies and services. Medicare does cover. Some can also be mailed. So that's something for them to look into. So the diabetic supplies and services, the supplies that are paid for and offered by Medicare, blood sugar testing supplies, the insulin and related supplies, such as the insulin pumps and therapeutic shoes. In the shoes in this instance, which we get very often throughout the state, here the individual pays 20% after their Part B deductible has covered it. So there's a little bit out of pocket. Foot exams and treatment for diabetes-related nerve damage. In this case also, so there's coverage for that. They can get the care that they need. I know there's a lot of individuals who have diabetes who have to be really careful with their feet and their legs and their calves and that part of their leg. In this instance with Medicare covers 80%, and then there's a 20% out of pocket for individuals who have Medicare Part B. Diabetes self-management training. So treating and educating is key for anybody at any age when there is a health condition that they're trying to manage or to hopefully get rid of. Here, Medicare provides a training for people who have been recently or previously diagnosed or even at risk of diabetes. In this case, this training is intended to help the individual self-manage their diabetes condition, and it provides up to 10 hours of initial training for the first year and up to 2 hours of follow-up training in subsequent years. So what that covers is the education about diet and exercise and an insulin treatment plan. So as their health changes, as their weight changes, as their food intake changes, as everything is changing in their lifestyle to stay healthy, this program does change for them. In this instance, if somebody has original Medicare, just out of pocket for this training, there's 20% for a Medicare approved amount that they would have to pay out of their pocket. Medical nutrition therapy services, Medicare covers services from a registered dietitian or a nutrition professional. In this case, an individual, it's just like going to see your doctor at a doctor's office. Same concept. They will have a doctor that sees them one to one, and in this case, they'll get an initial nutrition and lifestyle assessment by the dietitian or the professional, whichever they choose. It'll be one to one, as I mentioned before, and there'll be follow-up visits to check on their progress. For someone to be eligible for this, they must have Medicare Part B, and they must at least meet one of the following conditions. They must have diabetes, have kidney disease, or had a kidney transplant in the last 36 months. There is no cost in this in this therapy services if this is something that an individual is looking for. So this is a good thing. Good when something doesn't have to cost you anything. So now we go right into cardiovascular disease screenings. Medicare covers these screenings that check for your cholesterol and other blood fat levels, otherwise known as lipid. Blood tests are conducted once every 5 years for early risk detection. And this is for 2026. Medicare does change often, so this is what it is for 2026, but it could change next year. We do get the most up-to-date information regarding Medicare, so if something changes, we get notified and we share that with the community. In this case, with the cardiovascular disease screenings, the blood tests are conducted once every 5 years, I mentioned before. If you for early risk of detection, for what they're looking for is for heart disease and stroke. Medicare covers the lipid panel tests that include your total cholesterol, high density lipoproteins, and triglycerides. There is no cost for this screening here. So the preventative part here for Medicare is good because here's another free item that an individual can, the benefit they can use when they have Medicare Part B. Cardiovascular disease behavioral therapy. Medicare covers intense behavioral therapy for cardiovascular disease, referred to as a CVD risk reduction visit. One CVD risk reduction visit per year, what it includes is behavioral therapy. It's provided by primary care doctor or other primary care practitioner in a primary care setting, like a doctor's office. The visit includes these following components. It encourages aspirin use if benefits outweigh risks, screening for high blood pressure, intensive behavioral counseling to promote healthy diet. There is no cost for this cardiovascular disease behavioral therapy. This is another great component of Medicare. Medicare support services. So there are two, as we looked at the topics that we were going to cover today, there are two different departments in our the aging and long-term services have several departments, but there's two that we are housed in where we specialize. The first one that I'm going to show you here is the State Health Insurance Assistance Program, otherwise known as SHIP. So that is my title. There are 5 of us throughout the state. And what we do, we're national certified, and what we do, we assist older adults, caregivers, adults with disabilities, and their families with Medicare issues. What we find throughout the state is we have a senior or an elder who has an advocate, who has a family member or a friend or a relative who's caregiving for them, who's making sure that they're protected. So we also provide all of our programs, all of the resources that we have with whoever's taking care of the senior. We provide counseling, education, and outreach, as I'm doing right now. We have a ton of outreach, presentations. We do tabling events and so forth. We have a lot of networking and professional relationships where we bring other partners with us. If a certain county or a certain town has a specific health issue or a health topic that county or town needs, we bring those people there to try to service and provide that resource to the individuals or to the community. So counseling, outreach, and education is what we do. There's a long list of it. So what all you simply need to do is see what it is that your area needs, get a hold of us, let us know what topics or topic that you need, and we can definitely work with you. When I say we, the specialists that we have throughout the state. If you have a phone or you want to screenshot this, however you can, these are the individuals that you want to contact. You can see Albuquerque, Northwest, Northeast, Southeast, and Southwest. These are the SHIP coordinators in your area. So if you want a presentation, whether it's to the public or a networking, you're networking and it's a bunch of professionals, a nonprofit, whatever it is, we can do both. We can do them in person, we can do them virtual. So whatever works to get the information out there. Senior Medicare Patrol, otherwise known as SMP. That is another section of the work that we do. In this case, for Medicare beneficiaries, their families, and their caregivers, as I mentioned, we help prevent fraud, errors, and abuse. So we have several presentations about fraud, errors, and abuse regarding Medicare. The goal here is what we'd like to do is we like to keep the integrity of Medicare as protected as possible, because as you see on social media or on the news, there's a lot of Medicare fraud. And when you see that there's Medicare fraud, it's not in the hundred, it's not in the thousands. You see millions of dollars of Medicare fraud. It might just be on the news, it might be on social media, and people hear it and they just kind of pass it off like, oh, this is not a big deal. It's a really big deal, because Medicare is insurance coverage for every United States American citizen. So the price that you pay is depends on how much it costs to have Medicare. If there's a lot of Medicare fraud and they have to spread out the cost for what was going on, it's going to hit the individuals who have to have Medicare directly. So if people don't know how to detect or report Medicare fraud, or they need to know how to protect it, we're the individuals that can help you with that. We have presentations for that, and we help people learn how to protect their Medicare, just like their insurance card. What is really hard with Medicare, in the past when somebody's working, all of us here who are working, you go to you go to the doc's office and they say, can I see your insurance card? I need to make a copy of it. So you carry it in your wallet. Most people carry it all the time. Well, your insurance card and your Medicare card, your Medicare card's a little different. It's like your Social Security card. The the Medicare card has a very specific number, a member number that is to that individual. There's no group health plan or no group number or anything like that. It is one specific number for that individual. It is like a Social Security number. Once that number gets out like a Social Security number, fraud can happen. They can steal their identity. They can do a lot of things with it, like a Social Security number. So Medicare is pretty big when it comes to protecting the integrity of Medicare, because it will affect everybody. We like to educate and inform. So we do have presentations on that, yeah, virtual or in person. So if that's something that you feel your community needs, scams and fraud and so forth, we would love to go and do that. The New Mexico Aging and Disability Resource Center, also referred to as ADRC, that is another department that we're actually housed under. Here we provide a person-centered approach to empower individuals to make informed decisions about long-term services and supports. So what we like to do is, as our seniors get older, we'd like for them to be able to know who to go to when they need some help, or their family members. When somebody's sitting at home and they're really suffering, or there's something in their life, a resource that is just not that is not there for them, that they don't know that there's something available. And if they're sitting there and they're wondering, well, I wonder if there's help out there. If they could call us, that is our focus, is our seniors and their advocates. If somebody calls and says, hey, I've got a 72-year-old and this is going on in their home, is there any help out there? So what our job is to do is to find a resource, if we are not the resource, to help them get whatever assistance that they're looking for. If you notice, it also says we do short-term assistance, meaning that we don't carry a caseload like most social workers or other departments. We just get that question from them, and we provide them with the resource, and we want to empower them to be able to go and seek out some resources and keep up with it, so that they can get that resource and continue to use it as they need it. When they call the ADRC, The options counselors that answer the phone, they are here in New Mexico, they are in Santa Fe. So the resources that they offer them, they listen to the conversation, whether it's the senior or the senior's advocate or the caregiver, whoever it is, about what the need is. So those option counselors just listen and they screen and they try to provide them with all the resources. But what they can assist with on the phone once the phone call is made is maybe information about a care facility in their area. Maybe they're looking for home delivered meals, home health care, Medicaid. We help a lot with Medicaid, Medicare benefits, and transportation resources. These are not the only things that they do, but this is just a list of some. My office, as I mentioned before, is in Las Cruces. I travel significantly throughout Southwest New Mexico. If you are somebody in the area and you just want to connect and kind of see what else I have, a resource that I can bring, a presentation and so forth, please do take my information here from the screen. The 1-800 number you see is for ADRC. So if you are wanting to reach somebody in your area and you are not in the Southwest area, you can call the 1-800-432-2080 phone number. And in that case, you can call and find out who your SHIP coordinator is, and you will be connected with them so that you can get some presentations out. Email is a great way to get a hold of me. I did mention that I do some significant traveling, so email is great. If you send me quite a bit of details of what it is that you need, we can definitely connect. If you want to know how much time we need, just depends on the SHIP coordinator. Some of us have some fixed schedules where we go throughout the state, where it's recurring, where they're every month at a specific day of the month, specific time. We do leave some availability, but if you would like to see us, if we can get to you, give us a few days at least so we can schedule that. We do have social media. You can follow us on that as well. We do have an e-newsletter. So if you just want to take a picture, a screenshot this screen here, it'll also help you get the information you need just to connect. We do have a lot of, I'm going to go to the next one. I'll go back to this one. Here we go. So if you see on the bottom of the screen, you see we've got Facebook, Instagram, X on here as well. And we also have YouTube. So if you want a presentation, say you're doing something on your own, and maybe we cannot accommodate the date that you need there because you have a date already set, we have a lot of YouTube pre-recorded videos that you can pull them off our website. You can go ahead and use them if you want to give a presentation of a specific topic. Now I'm going to go back. So you can do this survey if you guys can, please. That'd be greatly appreciated. But on the YouTube videos, another thing that we do, so here on the feedback, it's why I'm going back to here. If you have any specific topics that you would like a presentation on that is not on YouTube, if you would just give the survey and indicate what you're interested in or what your community needs or your town needs or the county, whatever it may be, we can put that presentation together. I will stress that Medicare is very stressful, not just for the individual who has Medicare, but for their caregivers and for their family members. Because number one, people don't know who can I call when I have an issue. Why are they charging me this? And my doctor's telling me I need to change to something else. So we are your one-stop location to get that help without feeling like you're pushed to sign into anything, purchase anything. We just provide the education, the information, and we leave all the decisions to the individual who does have Medicare. Okay, so I'm going to leave this screen. And before I stop sharing my screen, is there any questions? And if you're muted, just go ahead and start asking.
I have a question. I'm
Yes,
sorry if I missed this.
that's okay.
So folks who are on Medicare in New Mexico, it feels weird to say, are they on a list? Are they on a list where you send them out information so they're like aware of the programs and things that are available through New Mexico Aging and Long-Term Services?
So are you talking about the services with New Mexico Aging Long-Term Services, or are you talking about
Yes.
Medicare?
Aging services.
Oh, us? Okay. Yeah. So what we do, the outreach that we do, when I say we're consistently out, no, you didn't miss anything.
Okay.
We go out almost. every other day of the week. And we do outreaches. We go to the senior centers, we go to community centers, we'll go to a church, we'll go to wherever there's a health fair, resource fair, libraries. We go out where our seniors are. So we have a lot of literature where we brochures, one pagers, mailers that go out in the mail. We just try to send it out based on funding to
Mhm.
let them
Right.
know we are here for you.
Okay. So it's all like
Mhm.
in-person outreach. They're not getting things like in the mail and things like that.
Sometimes they are, yes. They're getting some
Okay.
things in the mail from us, depending what the budget is for that year.
Okay.
Um, the one thing I kind of heard you, I'm not too certain if you asked this question or if this is what you wanted to know, but Medicare. The problem with Medicare, it's a federal benefit, and mail from the federal government doesn't go out to make somebody aware about Medicare. They're just supposed to know that they're supposed to
Mhm.
sign up. So that's where we come in because we try to do the outreach to let them know, hey, if when we're in the senior centers, not everybody there is 65. Some are
Mhm.
60, some are 55, or whatever the age are. And we just try to catch them so that they're not missing that opportunity to enroll in Medicare when they're supposed to.
Great. Thank you. That was my question.
Oh, you're welcome.
All of
Okay.
it.
Okay.
Great. Does anybody else have anything they would like to ask or share an experience or anything like that?
Was there anything in the chat?
No, I just dropped your
Okay.
information and how everybody
Okay.
can find the newsletter and such.
Okay.
Yeah. So I
Sounds
think you're
good.
just very comprehensive.
Yes, yes,
Great.
we try to, and I will tell you, it seems very quick, like there's not a lot of information, but there's a significant amount of information. So for everybody who's here today at this presentation, if you wanted just one topic and you're hosting an event or you have your health council meeting for your area, whatever it may be, and there's an hour, it was really hard for us to take pieces off of the three items and to talk to you about the preventative care. But if you wanted more details, we definitely have that.
Great. So you've gotten, thank you so much for all your wonderful information, for what you covered, what you're doing in the community. So yes, it was a very comprehensive, informative. Thank you so much.
Oh, thank
And
you.
Martha says thank you for all you do for older adults in the region, and you had a great presentation. But
Oh,
yeah,
thank you.
after this, probably early next week, I'll send out this presentation to everybody who is here and to all of our health councils, and then also with Melissa's information. So if you want to reach out or call the 800 number. Yeah, that's it. So thank you so
All
much for joining
righty.
us.
Okay. Thank you so much, and everybody, happy spring.
Yeah, happy spring, happy pollen times. Um,
Oh my goodness.
all the birds and bees will
All
be very
righty.
happy.
Well, thank you, everybody. Everybody take care. Thank you so much, Sam. I really appreciate presenting today. Everybody take
Yeah,
care.
thank you.
Thank
Have a
you.
great
Bye-bye.
weekend. Bye,
You too.
everyone.
Bye-bye.